Hi everyone, thanks for joining me today. I'm Dr. Milena, I'm endocrinologist at GluCare Health. I apologize because I cannot be in Chicago, but I hope everyone's enjoyed the conference and enjoy also the city. So let's jump to the presentation. I'm very excited to show our GluCare data today. I'm excited to share how AI-driven retinal screening is transforming cardiovascular risk assessment, especially in people with cardiometabolic disease. So I will show you guys our data, GluCare Health by metabolic. Let's start with the big picture. Cardiovascular disease remains the leading global cause of death. And one thing that we always discuss in the clinic, why this is still happening? We have good tools to identify the patients. We have medications such as statins, aspirin, and now the GLPs. Why this is still happening? In the Middle East and North Africa, we are not doing different. We know, especially in UAE, we see very high rates of death. 309 deaths per 100,000 people. So, cardiovascular disease is responsible for 30% of all deaths. These outcomes are closely linked to the widespread cardiometabolic risk factors, such as diabetes and obesity. Let's zoom in diabetes. Diabetes, both type 1 and type 2, significantly raises the risk by 2 to 4 times. So, the patients with diabetes typically carry multiple risk factors, such as hypertension, dyslipidemia, obesity. Everyone knows that the patients with diabetes, they don't come with only one disease. It's like a combo. And how it's difficult to convince the patients to change lifestyle and to use the medications. Traditional risks have been using for years. I remember when I was a student, we used to use Framingham, UCAPDS, and now the current American Heart Association released the PREVENT. So there are at least 22 cardiovascular risk scores in the medical literature. But the pool cohort equation is the traditional usage. But we know that these tools, they have been developed in foreign cohorts and can not identify patients properly, usually underestimating the risk. Coronary artery calcium score is one of the gold standard used to identify patients with intermediary and high risk. But coronary calcium score, unfortunately, is not easy to find. Is not available in many clinics. Is expensive, time-consuming, and can even burden the patient, and also involve insurance. For this reason, we need other tools which are more simple, economical, and non-invasive biomarkers. And for this reason, I brought this new tool. Thank God we have our eyes. The cardiologists of the clinic, Dr. Dalis, always use the sentence that I love, that the eyes are the wind of the heart. And we have been using retinal images for many years. And now we have one AI tool that brings the retina images also. The retina is the only place in the body that we can see the blood vessels in a directly visible, non-invasive way. Retinal changes often reflect the early system vascular damage. So could the retina provide a new way to assess cardiovascular risk? Yes, we have been using this for diabetes, we have been using this for hypertension. I always tell to my patients that our health is like a porcelain. So I brought this slide. I suggest you guys visit the Art Chicago Museum, where I found this Korean in tribute to Matt Hale and the Korean group, which is our beautiful porcelains. And our health is like a porcelain. If a small break can damage, and we cannot fix 100% again. So we need to focus on the primary prevention. And luckily, we don't have only ChatGPT, we have other tools using AI. And in 2021, this beautiful article brought by all the groups here from Korea, from Singapore. It's academic collaboration between these groups, and the technology has been licensed out to MedHale, and now it's approved in at least 80 regions. And how did it work? The AI diagnostic solution identifies future risk patients for vascular deterioration within 30 seconds. The AI analyzes pictures and stratify patients in low, moderate, and high risk. As I told you before, the data is massive. They publish data from using more than 200,000 retinal images across Singapore, Korea, and using UK back. These are data from the Lancet study, and the main takeaway is the Retinal CVD does a very similar job to the CT coronary artery calcium scores. Identify patients on low, moderate, and high risk. But when we add the Retinal CVD to the tools that we already have, adding, for example, the pool chord equation, we can have a more precise and personalized cardiovascular risk stratification. Here, just to summarize, the coronary calcium score includes radiation to the patient, is costly, and the retinal CVD is more affordable, high access to the patients. The patients at GluCare, I will explain a little bit later, they do in the same day of the consultation. There is no pre-preparation needed. So how does it work? As I told you, the patient comes in the first visit. We can do this in a picture, less than 30 seconds. The picture and the report is done. This is an example of the report. The system generates a risk report from the picture, from the photo, and provides a clear report that can guide the patient and can guide the doctor. It's so interesting when we show this type of reports to the patients that it can easily convince them to change their behavior or to start medication, especially statins. Everyone knows how it's difficult to convince one patient to use a statin. I'm certain each one of you already had one patient who doesn't want to use the statins. The moment that you show the patient has moderate or high risk, the recommendation here shows to use statins, and the patient in the same moment of the consultation say, no, doctor, I'm going to start using the medication. Okay, so now I'm going to bring our real world from GluCare Health by Metabolic. We have integrated the retinal CVD into our hybrid care model. So how do we work? We combine in-person visits with digital tools like glucose continuum monitors, Dexcom, Freestyle Libre, and Oura Rings. This allowed us to track our patients in real time, and the patients, they are being monitored between the visits. We don't need to wait the patients come back in 3 months to do the follow-up. So in the moment that I have the virtual team, coaches, dietitians, diabetes educator, all the physicians, we have data enough to monitor the patients within 3 months for the next follow-up. So we know how many steps they do, how many hours they sleep, and we completely understood that GluCare fit, the retinal MedHale or retinal CVD fits to our system. Here is just how it's the patient journey. They come to the first visit and we connect all the devices, and they can even log in their meals, and we monitor according to the CGMs and other wearables. So at GluCare, we always think that AI and all the tools needs to be done in the same visit, easily, quick. For this reason, we brought again the MedHale Retinal CVD. Our protocol includes patients above 40 years old with metabolic syndrome, hypertension, hyperlipidemia, and family history of cardiovascular disease. The moment that we receive the report, we identify the patients, and patients with low risk, they keep being monitored by the GPs and endocrinologists. But if the patient has moderate or high risk, we refer to the cardiologist who will do different tests like a stress test, carotid ultrasound, and so on. These are the data from 6 months using the AI, and we identified 264 patients in low risk, 236 moderate risk, and 91 patients in high risk. Dr. Idalis will present this study in Madrid, I believe in the European conference. For ADA, what we brought AI in patients with type 2 diabetes. So it's a retrospective study with type 2. We collected data from 115 patients with no previous cardiovascular disease. And in the clinic, our patients are quite young, less than 50 years old in average, but majority, of course, with obesity or overweight. And the results are 25% were considered high risk and 36% were considered moderate risk. Here are some other key results. We know patients with type 2 diabetes, they have other comorbidities, and 43% also have hypertension, and 83% were using statins in the moment of the retina picture. For the basic analysis, higher age, longer duration of diabetes, presence of hypertension, and a reduced kidney function were predictors of high cardiovascular risk. And for the adjusted analysis, age remained a stronger predictor. Female gender was associated with lower odds of high risk. To finalize, I brought one very interesting case. It's Dr. Idalis' case. It's a male patient, 37 years old, type 2 diabetes for at least 15 years. Here he reaches already with complications, retinopathy, and erection dysfunction. When Dr. Idalis did the retinal CVD, show a coronary artery calcium score of 100, and the CT scan was 0. The patient underwent to angioplasty in the right coronary artery. So one thing that, of course, we need to discuss if the retinal AI can detect the risk earlier, even when the CT misses. Well, to finalize, I want to conclude that the AI retinal screening is not a replacement for CT scan, but of course is a valuable complement to individualize the patients better. And because we don't live just using AI, these are real pictures of my patients, and it's very rewarding when we see them doing exercise, so I decided to bring these pictures. I'm glad to take all the questions, and I put also my email available. And I hope you guys have a good time in Chicago. See you. And also everyone can come to Dubai anytime to visit us.